Hi, my name is Christopher Akatsuka, and I, along with Tadas, Rosmary, and Joyce, am part of a CIS senior design group that collaborated with Dr. Ari Brooks, Dr. Annie Nankova, Catherine Choi, and M Health Labs to complete our project, Surgery Concierge. There are 53 million outpatient surgeries per year in the United States. For each of these surgeries, patients receive some form of instructions for what to do in the perioperative stages of surgery as part of a holistic healthcare plan. Oftentimes, these instructions are presented through disorganized, generic, and vague documentation, or even verbal communication. The lack of specificity and clarity in these instructions leads to surgery cancellations and suboptimal care, often with significant impact on health outcomes. We present a HIPAA-compliant service that aims to begin to tackle these issues by providing targeted instructions via digital means such as SMS, PDF, and calendar events that improve the clarity and delivery of patient surgery instructions. Even though our code's architecture was planned with Dr. Brooks's needs in mind, our solution is general enough to be extended to other branches of surgeries. In terms of measurables, we conducted surveys to collect feedback on our platform, which we'll now walk you through. Our architecture has three user-facing endpoints: the Surgery Protocol Input UI, Surgery Scheduling UI, and Patient UI. We'll start by looking at the Surgery Protocol Input UI, which is where the surgeon would create sets of instructions to be given to patients for a certain type of surgery. The instruction sets will then be sent to the Surgery Templates database. When a scheduler sits down with a patient to set the date for their surgery, they can choose the template relevant to the patient's surgery and customize which instructions which will be included in their set. This will be done through the Surgery Scheduling UI. The subset of instructions selected by the scheduler will then be sent outside of the firewall to be stored in the surgery's database with a key. This randomized key will be given to the patient, who can then go home and access the patient UI on their personal computer. While we developed our platform, we created a patient pilot that allowed patients to select the instructions relevant to themselves and sign up for any of our three services. We wanted to gather data on which services were most popular and any feedback before we fleshed out the final UIs for each service. Unfortunately, only 3 users signed up for our service, and due to time constraints, we were unable to retrieve feedback from them. As a result, we conducted a peer survey and CrowdFlower survey that garnered 124 and 200 responses respectively. Across the board, survey takers indicated that they found our service an improvement over the current handouts given to patients. Although the feedback from our surveys were positive, we acknowledge that they are not as good as getting feedback from real users of our platform. So we still aim to deploy the full-scale architecture in Dr. Brooks's clinic and collect feedback from Dr. Brooks, navigators, and patients on each of our 3 UIs. We also look to integrate the electronic medical record into our platform, perhaps to provide suggestions on the scheduler's interface. Deploy the full system behind UPHS's firewall and make architectural changes to accommodate the scaling needs of UPHS. This is our Surgeon Protocol Template UI. As you can see, you're able to enter a title for the surgery. You're even able to select from our existing templates, for which we currently have none. As you want, you can enter a patient condition, an instruction to patient, and how many days or weeks before the surgery date they should implement this instruction. If you so wish, you can decide to not check off an instruction that you entered, and this will not be included in the template. And if you also want to, you can click Add Item, and this will create an additional line for you to enter more information. When you're completed, you click Create Template. And this will provide you with a notification to let you know that your template has been successfully created. This is our Scheduler UI. With the patient, the scheduler will sit down to determine a date for their surgery. We'll arbitrarily select May 27th as the date of this patient's surgery. When we click View Available Protocols, it's a list of templates that we created from the Surgeon UI. When we click this, it will then show the conditions and instruction preview that the patient will be able to see. The scheduler will then select the instructions that they wish to include in this particular patient's set of instructions. When this is completed, they'll hit Complete Template, and this will take you to a page where it'll provide you with a 10-digit key. The scheduler will then provide this key to the patient, and the patient will then take this key home and go ahead and enter this into the patient UI. This is the patient UI. With the 10-digit key given by the scheduler, the patient will then go home, access this page, and enter their 10-digit key. When they click Get Notification Options, they'll then be given the option to download an ICS file, download a PDF file, which they can then print or download, or sign up for text message reminders, which will then query them for their cell phone number, and when they hit submit, they'll then be given a notification that they're now signed up. Thank you for your time and listening to our Surgery Concierge project.